Anxiety is a common experience. It affects millions of people. Many people feel nervousness and dread when they are anxious. These feelings are a normal part of the anxiety response. What many people don't realize is that anxiety impacts the body too. It can affect different organs. One of the organs it impacts is the stomach. Anxiety can cause stomach aches. It can also lead to more serious problems like irritable bowel syndrome or IBS. Understanding this connection is important. It helps us take care of our whole selves. When we experience anxiety, our bodies go into fight or flight mode. This is a natural response to stress. During this response, our bodies release hormones. These hormones prepare us to fight or flee. These hormones also affect our digestion. They can slow it down or speed it up. This can lead to uncomfortable stomach problems. The good news is that there are things we can do to manage anxiety's impact on our stomachs. We can learn to manage our stress. We can also make changes to our diet and lifestyle. These changes can help calm our minds and bodies. By taking care of our mental health, we also take care of our gut health. The gut and the brain are constantly talking to each other. This two-way communication is called the gut-brain axis. This axis is a complex system of nerves and chemicals. It allows the gut and brain to send messages back and forth. One way they communicate is through the vagus nerve. This nerve acts like a highway. It carries signals from the gut to the brain and vice versa. When we feel anxious, the vagus nerve can send signals to the gut. These signals can cause a variety of symptoms. Some people may feel nauseous. Others might get diarrhea. Another way the gut and brain communicate is through neurotransmitters. Neurotransmitters are chemical messengers. They carry signals between nerve cells. Some neurotransmitters are made in the brain, others are made in the gut. One example is serotonin. Serotonin is a neurotransmitter that helps regulate mood. It is also involved in digestion. The gut microbiome also plays a role in the gut-brain axis. The gut microbiome is the collection of trillions of bacteria that live in our intestines. These bacteria are important for digestion. They also influence our immune system and our mental health. Anxiety can manifest in many ways. Sometimes it shows up as physical symptoms in our stomachs. These symptoms can vary from person to person. Some common symptoms include stomach pain, nausea, and changes in bowel habits. Stomach pain is one of the most common symptoms of anxiety. This pain can range from mild to severe. It can be sharp or dull, constant or intermittent. Some people describe it as a knot in their stomach. Others feel a burning sensation. Nausea is another common symptom. It is the feeling of wanting to vomit. Nausea can be triggered by stress, anxiety, and strong emotions. It can also be a side effect of some medications. Changes in bowel habits are also common in people with anxiety. Some people experience diarrhea. This is characterized by loose, watery stools. Others experience constipation. This is characterized by infrequent or difficult bowel movements. These symptoms can have a significant impact on daily life. They can make it hard to concentrate at work or school. They can also make it difficult to enjoy social activities. The good news is that there are effective ways to manage anxiety and the stomach problems it can cause. Addressing both the anxiety and the gut issues is important for overall well-being. Therapy is often recommended for managing anxiety. Cognitive behavioral therapy, or CBT, is one type of therapy that has been proven effective. CBT helps people identify and change negative thought patterns and behaviors. It teaches coping mechanisms for dealing with anxiety. Lifestyle changes can also be helpful. Regular exercise, adequate sleep, and a healthy diet can all contribute to better mental and physical health. Stress reduction techniques like yoga, meditation, and deep breathing can also be beneficial. Dietary changes may also be necessary. Some people find that certain foods trigger their symptoms. Common trigger foods include caffeine, alcohol, fatty foods, and processed foods. Keeping a food diary can help identify trigger foods. In some cases, medication may be necessary to manage anxiety or stomach problems. Antidepressants, such as selective serotonin reuptake inhibitors, or SSRIs, are sometimes prescribed for anxiety. Medications to treat stomach problems, such as antacids or antidiarrheals, may also be helpful. If you are experiencing anxiety or stomach problems, it is important to talk to your doctor. They can help you determine the cause of your symptoms and recommend the best course of treatment. Remember, you are not alone, and there is help available.